Hi, and welcome to SchureMed, where we're designing and building the future of patient positioning.
Today we are highlighting SchureMed's intuitive and easy-to-use TKR for total knee replacement. The TKR system is an innovative surgical knee positioner that is fully adjustable, completely secure, and autoclavable. To assemble the TKR, first, attach the stainless steel mounting bar to the cross support bar with the star knob and washer. Next, attach the two blue base plate clamps to the cross support bar, again using star knobs with washers. Slide the stainless steel mounting bar into the CamLoc clamp and secure at the appropriate height with the star knob. Ensure that the TKR base plate is flush with the cross support bar prior to tightening the knob. Place the white plastic insert into the adjustable side block with the notch side facing up. Next, slide the assembled block onto the rail of the base plate track system. Finally, insert the ball of the boot into the adjustable slide block and secure with the locking handle lever. After lining the stainless steel boot with SchureMed's sterile disposable boot liner and securing the patient's foot into the boot, the patient's operative leg can easily be adjusted and precisely secured with the desired amount of extension, flexion, tilt, and lateral medial rotation. SchureMed's TKR is manufactured in the United States and is available in both 61 cm and 76 cm lengths. Each version includes a custom sterilization tray with specific compartments for each item and comes with our 2-year rest assured warranty. At SchureMed, we are designing and building the future of patient positioning.